Welcome. Thank you so much, everyone, for being here tonight on this special evening for World AIDS Day and our special presentation. Thanks for everyone who is joining us online as well. I'm Michelle Miao, a member of the Board of Governors for the Commonwealth Club World Affairs. The club has been around for over 120 years. It's my most favorite organization, not because I'm part of the board, but because it is focused on its mission to finding the truth by bringing thought leaders like yourselves together to discuss important issues of our time. I really want to take a moment to thank you all for being here. I know it's a Monday night. It's the 1st of December. With the recent news that there are some in powerful positions to that point who've decided that they won't recognize today or they won't talk about today, we're fortunate enough to have community members like yourselves. And these community members aren't just friends and family, but it's also advocates and activists, doctors, scientists, innovators, world leaders, folks who are dedicated to eradicate HIV/AIDS. I want to take just a 1 second to echo the words of the executive director of UNAIDS, who every year releases the Geneva report. AIDS is not over, and this year's disruption to the global response has exposed the fragility of the progress we have fought so hard to achieve. And so you're here tonight to be a part of not the disruption, but to continue the progress. And we all thank you so much. We have a special guest who has introduction remarks before we begin our very important conversation. And so I'd like to welcome tonight Dr. Kimberly Brown, who's medical director for ViiV Healthcare. Dr. Kimberly Brown.
Good evening, everyone, and thank you all for being here on this very special occasion. So I'd like to start by thanking the Commonwealth Club for this evening, for this very important conversation, and for bringing awareness to HIV, and especially World AIDS Day, since it's not being recognized by others as much as it has been in the past. And I'd also like to thank you all for being here as well. And it's an honor to be here to speak to you a little bit about World AIDS Day on behalf of ViiV Healthcare. We're the only pharmaceutical company that is 100% dedicated to HIV. And when I think about World AIDS Day and what it means, I often reflect over the past few years in a lot of the progress that we've made. I also carry two feelings at once. One of immense pride about how far we've actually come, but also about the incredible urgency and the work that still remains for us to do and to tackle. So when I think about today's discussion, and let me say, you're going to be in for a real treat with the panelists, we need to think about whether the fight for HIV is really behind us or really ahead of us. And in my opinion, it's really both. We've made extraordinary strides, and antiretroviral therapy has really transformed HIV into a manageable condition, as you all are aware. We have various different options, from daily oral pills to long-acting injectables for both treatment and PrEP. And options like PrEP, as well as U=U, have allowed countless individuals to take more control of their sexual health and well-being. But at the same time, we also see that there's real challenges. We have a frayed public health system, clinic closures, issues with access, as well as growing pressures on organizations that have been the backbone of HIV care for numerous years. But if we picture progress moving forward, we should look at HIV as a marathon. We've already been running this race for many years and for many miles. There were times when we looked ahead and it appears as though that the finish line was moving, and it also was in sight. But at this point in time, we see that the course has shifted, and there's new obstacles that are appearing on that route. But we will still get there. In this evolving path to the end of the epidemic, this is why innovation is going to be really central to getting there and to actually meeting the finish line. And for us, innovation is not just about focusing on new medications and medication delivery mechanisms, but it's also about rethinking access, centering community voice, as well as ensuring that the advances that are available actually meet the people who actually need them. So let's talk a little bit about prevention. Well, we know that prevention is essential to ending the epidemic along with treatment used in partnership in order for us to have an HIV generation, HIV-free generation. And as resources shrink and it provides a shift, it's essential for us to think about the progress that we've made and to push even harder and to really get some fire under us to make things happen. We can't lose sight of the people who depend on us the most, especially for continuous and effective treatment. Long-acting injectable treatment is an important innovation in this regard because we have some people who struggle with taking daily oral therapies due to stigma, unstable housing, mental health challenges, as well as many other factors. But in addition to system challenges, I also want you to think about a path forward focusing on community. For decades, people that have been affected by HIV have been the ones to point out the gaps that science alone cannot see. So it's going to be a collaboration of many, many different minds putting together to really create effective treatments and to provide access to those who need it. And we've learned over time that science is actually co-created with communities. This means working with community-led organizations, building research partnerships that prioritize the community as well as well-defined outcomes, and supporting grassroots efforts. It also means listening. When community groups say that clinic hours are a barrier or that stigma is the leading reason why people are not being adherent to daily oral therapies, we need to listen and we need to act on that insight. The last area of innovation that I want to talk about is in the clinical setting. So think about the clinical care map and that journey that a person who's living with HIV or someone who could benefit from PrEP might actually have to go through. So we realize that HIV care has really been more so focused on large academic centers as well as specialized clinics and LGBT health centers that have been, really the areas of expertise as well as trust, first and foremost. But those sanctuaries are under pressure right now for a lot of different reasons. And if they shrink, how are we actually going to move things forward? So we need to reimagine how care will look and what that treatment pathway is actually going to look like. We should be thinking about primary care practices, OBGYN clinics, as well as urgent care centers, where conversations about PrEP, as well as HIV screening and treatment, are normalized as a part of overall care. We also need to explore ways to expand competence and compassion across the entire health system. So how are we actually going to do that, and how are we going to achieve that? Well, it's going to be a few different ways. Thinking about workforce as well as thinking about education, equipping a broad range of providers with not only the tools, the confidence, and the pathways to connect patients to prevention as well as for treatment. And in conclusion, let's think about what all of this looks like when taken together. How do we innovate the HIV response from top to bottom? We know that this isn't going to be a small task, but what we do know is that we have the confidence and we have the many, many lessons that we've gained over 40 plus years. We know that we're able to do it, and we know we have the tools to do it right now. We've trained for this marathon, as I mentioned before, and we know that the HIV community is not one that will back down. There's a lot of passion, a lot of fire, and a lot of interest, especially now, in getting us to the end of the epidemic. Progress won't be automatic, but it will take persistent partnership across industry, clinicians, community organizations, as well as policymakers. We know that all of you, as well as the medical community, are committed to putting forth innovative ways that are equitable, community-led, as well as practical to make sure that people who need medicines and care can actually get that. So, in conclusion, I would say that our hope is that when we meet at the next World AIDS Day in 2026, that we can actually point to some of the progress that has been made over the next year, being one step closer to that finish line. So thank you for your time tonight. I can't wait to hear about the panel. You're really going to be in for a treat. And thank you all for being here this evening.
And now let me introduce to you our esteemed panel. We have Dr. Dimitri Daskalakis, who is an infectious disease physician and also a public health leader. Dr. Monica Gandhi, who's professor of medicine and associate chief Division of HIV and Infectious Diseases, Global Medicine for the University of California, San Francisco, also the director of the UCSF Center for AIDS Research, and also medical director, HIV Clinic, Ward 86, otherwise known as, for the San Francisco General Hospital. Maybe I should keep going on. Mom, yeah. We also have Dr. Tyler Jameer, who's the CEO of San Francisco AIDS Foundation. And we have Gary Virginia, who's a fundraiser and activist, a volunteer, and an HIV AIDS survivor. Last but not least, our moderator for this evening, Dr. Naz Mohammed, who is founder of Osra Medical and president of All One Foundation. Let's give a warm welcome to our speakers.
Thank you so much, Michelle. Is this working? Is it on? Can you guys hear me okay? Yeah. First of all, what are you all doing here? This is canceled.
Yeah.
But apparently when we're told we're canceled, we don't stay home. So go figure. So first of all, thank you so much, Michelle Miao and the Commonwealth Club for hosting us. I want to thank all of you also for being in community today. I know you had a lot of things to do. I know it's the holiday season, and I also know that San Francisco is holding a lot of events to celebrate this day, really, and honor it, and highlight all the ways that this space is challenged. And this is why we're gathered here today, really. We're gathered to talk about a problem that is very much still a problem, and wanted to bridge what we know with what everybody else knows. There are a lot of people in the room today, and there are even more people joining us online from the rest of the country and globally, actually. And this conversation impacts all of us. So I'm going to jump right in. And I'm going to pose questions to all of you, so feel free to pick it up, whoever feels called to pick up to answer the question. But I want to start with funding and PEPFAR. What is PEPFAR? Can one of you just explain what this program is and how it impacts HIV care globally?
Well, the President's Emergency Plan for AIDS Relief, PEPFAR, was formed in 2003 by President G.W. Bush. And I remember when he announced it, and I actually fell to the floor because I was so amazed by this idea of this program. And it was really a program that provides a lot of the antiretroviral therapy around the world. There's 40.8 million people living with HIV. 31.6 million are on antiretroviral therapy, the HIV therapies, and a lot of that was through PEPFAR. It's actually saved 26 million lives, been prevented transmission from mother to child. It's been incredible. So PEPFAR, every 5 years, both the Democrats and the Republicans say yes, because this is something that is bipartisan. G.W. Bush started it. We should all be behind it. There was not an issue. And then Biden, to be fair, under the Biden administration, they didn't re-ratify it for 5 years, which would have been great. They didn't. They just gave it a year-long funding. And then this new Trump administration started. And on January 24th, which was 4 days after the inauguration, there was a work stop order put into place, and Rubio said, stop all PEPFAR activities. Such a shock. Things went horribly. And that night, all these people in the State Department who were super brave got models on Rubio's desk and said, do you know how many people are going to die if you do this? And he, by the 28th, put a waiver in place that said care and treatment can continue, but prevention is only for pregnant women, not for anyone else who's at risk. And beyond that, care and treatment continuing. In the meantime, they were gutting USAID, which was its partner. So PEPFAR is more hobbled than it has been. and it was saved from rescission, but we're super worried about it. And there's like leaked State Department documents that they want to phase it out. And it's so important. It's been so life-saving. And importantly, it's really brought a lot of global security to the U.S. if people care about that. You know, the soft power, like JFK, the idea that we bring goodwill by being global health ambassadors, and PEPFAR brought so much goodwill. So there are an excess of about 120,000 people alone that have died in the Trump administration from AIDS because of what they've done to hurt and cut PEPFAR.
Yeah. And I think another concerning thing, Dr. Gandhi, is talking about PEPFAR and national security, the administration has also decided to make aid more transactional. So they are working on bilateral agreements with countries where they're in effect going to exchange PEPFAR aid for access to specimens for organisms of pandemic potential or data. So, and there's a limited time frame that they're even willing to do that. So I think that PEPFAR is kind of being held hostage, not only by the sort of desire not to sort of focus on priority populations, but also to try to leverage it, to try to get specimens after the U.S. withdraws from WHO.
Well, I think the very real reality, just to name it, is that when these funds collapse, inequity surges, especially among Black and brown folks, among trans folks that live all around the world. And we are going to continue to see those inequities play out at just such a disproportionate rate when we disinvest from countries around the world.
So I want to take that as a segue to my next question. Speaking about groups of people that are minorities that are more targeted, there have been a wave of executive orders targeting fundings that serve these communities, and also another series of executive orders targeting federal grants making. So anybody feels called to comment on that? I want to talk about the SF AIDS Foundation versus Trump in a moment, but I want to talk about grant making first.
Sure. I think maybe since I was the closest to it at CDC before I left, I can comment on that, which is, I think that the executive orders were generated, and then just in fairly recent history, one of the things that happened at multiple agencies is that they updated the sort of pages on the web that talk about the mission of the agency. So the example, I'll use the one that I'm familiar with, is at CDC, they updated the website that's the About CDC page to really become about the ideology that you must adhere to be in compliance with CDC's priorities. So it seems like an innocuous web page. It just supports some of the EOs, some of the executive orders, but that same language was also sent to all the grantees of CDC, NIH, HRSA, et cetera. You all can attest to that. And that is a warning shot, which tells you what the priorities are of the agency. And why is that important? There's something called the CFR 200, which is way more information than you need, but it's the document that tells you like what grants are like and what the sort of terms are of the grant, including how a grant can be terminated. Yeah. And so it says in that document that agencies or recipients that are not in adherence with the priorities of the agency can have their grant canceled. And so what happened is they've just sent those priorities, which are the EOs around gender, the EOs around DEI, and then that in effect puts everyone on warning that at any point they can just decide that they will cancel your funding if you're not in compliance with the agency's priorities. So when they were EOs, the CFR 200 didn't count toward compliance. But now that they've set it as agency priorities, those are the priorities of the agency, and they can say, you're not in compliance with those, and so we can rescind that funding.
I want to put like some context for the audience a little bit about why we're talking about funding. And this issue, I'll come back to our like HIV survivors on the panel as well to talk about what it was like when we did not have support system to fight HIV. But globally, it is still currently a reality. The Independent published an article last week where they investigated the current impact of the funding cuts in Uganda, Zimbabwe, and Senegal. And they saw people dying of AIDS over the last 8 months, boys and girls newly orphaned, mothers really stressed about passing HIV to their unborn children. These are lived realities that are happening today, and that's what happens when we pull out the support to fight HIV. So I want to transition to the two of you, Tyler and Gary, and talk about your own journey with HIV and how it was like in the 80s.
Well, for myself, I moved here in 1987 and had a job at San Francisco State in development, and I fully intended on having a long career and not having to move again for my career. And in 1988, I had a kidney stone attack, and when I did a blood draw, they said, you realize you're HIV positive, and I didn't realize. And I started monitoring my blood work, and from 88 to 95, the virus became active, and in 1995, I was still working as a gallery director full-time as I got sicker and sicker, and then I started AZT, and within 11 months, my doctor said, you need to stop working, and I was experiencing a lot of skin rashes. I was having thrush infections in my throat. I was doing, I think it was monthly pentamidine breathing treatments at Davies Hospital as a prophylaxis to not get pneumocystis pneumonia, which people were dying of. I had wasting syndrome. I was taking medical cannabis pills to stimulate my appetite. I remember being in my doctor's office saying, what would be good to eat and what should I avoid? And he looked at me and was like, eat anything you want any time of day. I don't care if you wake up in the middle of the night, eat a gallon of ice cream. And I lost 500 friends to the disease. Twice my best friend in San Francisco. And if you've never experienced that, no matter where you live, it causes something like a flight or fright kind of syndrome. You start blocking out certain information and you become like in self-preservation mode. And once you lose your job, there was an agency, AIDS Benefits Counselors, was one of the first AIDS agencies in San Francisco, as well as the AIDS Emergency Fund. And I tapped into those quickly, and they guided me with free and confidential disability benefits counseling, which was just a lifesaver. They guided me on how to leave my work to maximize my benefits, how to use COBRA and then transition to OBRA benefits, and did a timeline through like age 65, which guess what? I'm 65. Thank you. I'm celebrating my 30th year as a survivor, and I'm resistant to most all of the medications. I feel like I took my medications as told, but developed resistance. And I was working with the late Dr. David Senachek, who was a leading pioneer in putting HIV in remission, with the doctorate from Harvard in virology, and he kept figuring out a way to combine the medications and the newest one that was in the pipeline to keep me alive. And as soon as I started protease inhibitors in 1996, my health started improving, and I immediately started raising funds for the AIDS Emergency Fund and AIDS Benefits Counselors. Both of those programs are now under PRC. And today I was on the phone with PRC, helping them guide me on my Part D drug plan because my monthly cost is tripling. Okay. So it's the AIDS Drug Assistance Program that they're going to apply for me to pay for that copay that's tripling in cost. So it's one example of how it's so critical that we double down to support the nonprofits, especially if they're losing government funding, because there's fewer and fewer AIDS agencies. Many have had to merge. So I think that's really like my biggest thing is to backfill, double down, and help the people filing the lawsuits against this administration, and to help the nonprofits that are doing direct programs and services.
Thank you so much for sharing this with the audience. Gary, I know it's quite vulnerable to share such intimate details, and I'm so glad you're with us today.
Of course.
Also, I'm hearing that there were resources that were lacking in the 80s, and there are some that exist now that you count on. So I want to transition to you, Tyler, to talk about nonprofits and their funding and how they support current communities. We also mentioned the current funding threats, and I understand your organization is a plaintiff versus the Trump organization currently.
Yeah, my organization, San Francisco AIDS Foundation, like many organizations across the country, relies on a mix of direct and indirect federal funds to sustain our operations, which means we have some grants that are coming directly from organizations like the Centers for Disease Control or Health Resources and Services Administration, and then others that channel through local and state health departments and then come directly to us. But either way, those dollars are federal in nature, and they help fund everything from keeping HIV and STI screening free and low barrier to the community, to the case management services and the linkage to care and the navigation services that are vital for our community. And as early as the first few weeks after the inauguration, through our federal portals, we started seeing these very scary letters. It's the only way you can describe them, because they were just a bit of a nightmare. I mean, they essentially were warning agencies across the country to stop all services immediately if they were serving trans folks. They were telling you, if you are employing trans folks, to let them go immediately. They were telling you to remove their existence from your website, to stop reporting about them on all of your grant reporting. It was a really hard moment to realize, is this something we actually have to do or not? And we were really uncertain about what it meant for our ability to continue services if we didn't comply. But we also knew, as an organization that started in the height of the epidemic, as one of the very first organizations in this country that was born out of government neglect, that we needed to remain grounded in our values to fight back against these attacks on DEI and on trans folks, that we couldn't be San Francisco AIDS Foundation without acknowledging diversity, equity, and inclusion, and that we couldn't exist to serve the people under our mission without serving trans folks. And so we decided our best strategy was litigation, and we essentially had a very powerful board meeting, one I will never forget, among my amazing board at San Francisco AIDS Foundation. And after the one thing you don't ever really want to do as a CEO is have to tell your board, like, hey, I want to sue the president. But I did, and they were very happy to join me in this moment. And we decided to go up against the administration on 2 of the DEI orders and an order against gender ideology, and we were successful in securing a preliminary injunction. So our PI protects San Francisco AIDS Foundation alongside 8 other plaintiffs. Lambda Legal has been amazing. They did all of this work for us for free. So shout out to Lambda Legal. And we are, yes, Lambda Legal. And we are currently protected. It means we were able to get the federal funding that we lost back. So were the 8 other plaintiffs, and we're currently protected from other funding attacks that are specifically naming DEI or the serving of trans folks as the nature by which they're funding our current attacks on our funding. We, however, like many folks, are headed to the appellate court. So we're going to the 9th Circuit in late January, early February. The government has decided to appeal. We're feeling as good as we can in the current environment, although being here in Northern California, we think we'll draw a great judge and have a really good chance.
Thank you. Thank you so much for your leadership. I know it feels really uncomfortable to push back. Right? It feels really uncomfortable to go and speak up about what's going on with you and how you're being crushed by a system that doesn't see you. And I want to lean a little bit more into the DEI situation. And I want to talk about it in context of research. And because I know this has affected the research space as well. And I want, maybe this would be a question for you, Dr. Gandhi. Like, I want to share with the audience how this impacts our ability to objectively study a certain population.
Yeah, so the executive orders that everyone's referring to were actually filed on January 20th. So remember, there was like many executive orders that day, and two of them that are most relevant to our field are there's no such thing as gender. There's just two biological sexes. That was put in an order. And then the other one was no diversity, equity, and inclusion. And they have really leaned in hard on those. And so because we're the NIH, where we get all our research funding, is part of the Department of Health and Human Services, and that's led by RFK Jr., who follows those executive orders. Our research grants are not, two things happened. One is DOGE went into the NIH and stopped grants from going out, even if they didn't terminate them, that had words like diversity or trans in them. And then they actually terminated grants, over 1,300 federal grants that were studying these different topics. And that was shocking, because you'd get this letter and from DHHS that said there's no such thing as gender, so you can't do this research. And so they would just take away the money. And a federal judge in Massachusetts, who I named my cat after, Judge Young, because he was so brave. He was Reagan appointed, but he said, this is void, illegal. He called it arbitrary and capricious. He said, are we going towards a society? Do we really want homogeneity, inequity, and exclusion? Is that what we're going for? And so he said that.
Yes.
And he essentially said it was illegal to terminate all those grants, and those grants actually were reinstated and put back, but it doesn't mean that any other grant can use those words. And actually, people are so frightened that if for some reason they wanted to stand up, they're just very frightened that they won't get the grant funding. And the problem with research and the problem with academia is that we're so dependent on the National Institutes of Health that I have to say that I think we haven't been as brave as you all have. And I think what people have done is that they put in their grants, and their grants have taken out those words. And the idea behind researchers' thinking is get the money and then you can do the good work, but you can't do any work without money. And, it's a very hard thing, because I was at another meeting and someone said, then that's erasing, to do that, to put in a grant. And then what the researcher would say is, I'm using the word difference and not diversity, but it's very painful and everyone feels terrible about it. And it feels like censorship. It clearly is censorship. It feels like restriction of academic freedom, and everyone is feeling terribly about it. So no one is feeling good. Every day something bad happens. And today, the World AIDS, what you were referring to as World AIDS Day, has been commemorated since 1988. Jonathan Mann started this day. He was the first kind of head of the WHO AIDS Department of AIDS, to fighting AIDS, and that's called UNAIDS now. And he started World AIDS Day, and every year the U.S. has commemorated it. And this is the first year that the administration said we're not going to commemorate it. And so there hasn't been public statements. There wasn't an event on the White House lawn like there was every year up till this to commemorate this day. And it's important to commemorate this day. They said, we don't commemorate days anymore, but that's not true. They commemorated National Manufacturing Day and Autism Day. But so I think so much of this administration is attacking what we all fundamentally hold dear. And what we hold dear is that HIV is a disease of disparities, inequity, and exclusion. It is that kind of disease. It is an infection that affects people of poverty, and people are stigmatized, and these words are inherent to what we do. And so half of the grants that got terminated at the NIH had something to do with LGBTQ population. So it is just attacking the fabric of what meant so much to us.
I do want to go ahead, Dimitri.
I was going to say that, I think, they're at least internally consistent. I think that the idea of a president sort of talking about the importance of World AIDS Day when they're potentially, removing the entire division of HIV prevention from CDC, are potentially ending the HIV epidemic, are cutting components of Ryan White. I think that it's shocking, not shocking, that they're not able to talk out of both sides of their mouths. So I think it is one of the things that I thought was really interesting was that the statement that came from state was commemoration day is not a strategy. And I agree, a commemoration is not a strategy, but they're actually trying to cut the strategies that have been very efficacious. So the commemoration day is just symptomatic of the disease, of neglect, of historical neglect. And again, it is really undercutting a legacy that is frankly a Republican legacy, right? So we talked about George W. Bush, Ryan White also comes from a Republican administration, ending the HIV epidemic from Trump 1. So I think that their legacy is going to be one of destruction as opposed to creation for the HIV movement, which I think is against decades of work that others have done.
Yeah, I was just going to say that this isn't obviously the first time that the government in the HIV movement and response has chosen silence. It's largely why we have the moniker silence equals death within our movement. And in this particular moment on this day when the White House chooses silence on World AIDS Day, we don't have that luxury as a community. I mean, there are lives on the line. We all know that as people working in the field every day. But here in San Francisco in particular, we could be the first city to get to 0 new HIV diagnoses, and very likely will be. But that requires a consistent investment in dollars. So the retreat of dollars is dangerous for our progress in ending the epidemic. And one thing I wanted to make sure I looped back to say is that while this moment of federal retreat is definitely a dangerous moment in our funding sphere, that is just kind of the cherry on top of what was already happening. So prior to this administration, we already were seeing a retreat of funding from the HIV space from other places. We were seeing a lot of foundation and corporate support start to pull out of the HIV space prior to this year. Over the last 5 years, we've seen almost a 30% decline in corporations and foundations supporting the HIV and AIDS sector here in the United States. And a lot of those corporations are really feeling like, we've made such significant progress over the last 4 decades. We've seen you through from the very beginning. And now it's time for us to step away and support something new, when in fact, this is like the worst time for folks to step away, be there with us all the way till the end. I really think of this moment as like the collision of extraordinary scientific progress meeting extraordinary political retreat, like all at once. We have just the perfect pathway to the end when everything, funding and political support, political will is pulling away.
I do want to follow on and build on a couple of points you guys brought up. One of them was the fact that new HIV cases follow the crack in our society and impact the people that are left out. And a lot of people are quite impacted right now over the last year, specifically trans people and immigrants. And I'll tell you some things I heard behind closed doors. Physicians were talking about strategies to navigate ICE being in their bar parking lots when those individuals are seeking care, whether it's prevention care or treatment. I have also heard people in community choosing to take their chances and not seek care, because going in to seek care can be more consequential for them. And then on top of that, the people in those spaces where the care is being provided, or the communities themselves, are afraid to speak up and raise these issues. So I wanted to ask you, have you heard that in your spaces? Have you heard of people being driven away from care because they're afraid, or have you heard of colleagues having certain thoughts that they're keeping to themselves out of fear of retaliation? Is this the climate where the HIV landscape or space is in today?
Yeah, I can speak for San Francisco AIDS Foundation in that we've had to work really hard to help our clients understand that our space is truly as safe as it can be. We've done our best to ensure that the spaces that we offer at San Francisco AIDS Foundation are protected, and that our security knows what to do if ICE were to show up, that our staff are trained to know what to do in moments of crisis at our agency. And we're working really closely with our Latine Health team to make sure that our community feels as safe as possible. With that said, we also know that this is a moment where we're going to have to take a lot of our services to the community. Like, folks are not feeling very safe to come to places, even if they know that that particular agency is safe. They still have to navigate often the bus system to get there, or the neighborhoods by which those organizations exist. And so our navigation team, our health resources team, is having to figure out how we can meet people where they're at in different neighborhoods, in their homes. And that's really challenging when it's a social service, let alone if it's clinical care.
I mean, that was this awful thing the Department of Homeland Security did the first week of the administration, which is that they said they can come into schools and hospitals and clinics and healthcare settings, which was, those were always sanctuary sites, even in a non-sanctuary cities. So that really put a chill on specifically Latina immigrants coming into care. We have been more spared, I have to say, in San Francisco than LA was, and these other cities, Portland and DC and Chicago, because there doesn't seem to be a personal grudge. Everything seems to be related to personal grudges, like Pritzker is Hyatt, and he's the governor of Illinois, so Trump doesn't like Chicago, apparently. So,
Okay, Chicago doesn't like him either.
So it's just, it's very haphazard, and it's, you can trace it back to these grudges. So, but it's just a chilling effect. And then I think the other concern is the Medicaid changes that will occur when this big bill kicks in. The Medicaid changes, what the state has said is that they will keep undocumented immigrants that are currently enrolled in Medicaid on Medicaid, but not new immigrants. And so we need our city really to help bring back Healthy San Francisco to support our undocumented immigrants who are new enrollees so that they can get supported for Medicaid. So, and I hope that will happen actually, but that's not going to happen in other places. And so I'm worried about Medicaid because 40% of people living with HIV are on Medicaid.
So I'm going to channel my deep Southerner, because I live in Atlanta now, which is, I think your point is really important, that I think that places like, my old hometown, New York City, places like San Francisco, frankly, places that have like a strong tax base that are also willing to advocate for populations, I think will be able to advocate for many of those populations and cover some of the gaps, really not all of the gaps, right? Because the gaps can be pretty big. But I think that what this will do, and I think Dr. Naz, this is to your point, is like the sort of issues that are like the tracks that already exist for disparity will just be made deeper and deeper. And so I think you'll see, disparity locally, but I think when you look at it nationally, HIV rates in the South are going to go up. I mean, I just saw the New York City data where they have an increase, again, of about 5%. Over 80% are Black and Latino individuals, and most are men who have sex with men or same gender loving men. So I think that ultimately, I think the disparities will deepen and they're going to follow the tracks that you expect around race and gender identity. But I just want to raise one other issue regarding change in behavior, which is that, I think San Francisco, I know will be different. I know for a fact New York City is going to be different because I've spoken to them, but we're not going to actually be able to see some of the data on gender across the country if the local jurisdictions don't continue to collect it. And the collection devices, and you can speak to this, I think, that are coming from CDC and the federal government have erased gender. So now in disease surveillance, which is so critical in like sort of identifying your endpoints, and frankly also for funding sometimes, some populations will be completely invisibilized because of these actions.
Yeah, so we fought for a long time to get the federal government to collect what we call SOGI data, sexual orientation, gender identity data. And finally, after like years and years and years of advocating, we were able to get those fields. And then eventually they finally became mandatory fields for a lot of our federal reporting in many of our grants. Now those fields went from being mandatory to just existing to now like you cannot even see them. And so if you want to collect that data, you have to collect it on your own. And there's not much incentive to do it, especially if that's your only reporting system. A lot of organizations only have the federal databases by which they input their data. They don't have their own electronic health records. There's not really a place other than maybe an Excel spreadsheet for them to keep this data. And so we're going to be missing just a lot of significant data. I think to tag on to something that was being talked about earlier too, I have a lot of concern for changes in Medicaid and how it will impact our trans community, as we've talked about as well. I mean, I think we are really worried about young trans people in particular, those 19 years of age and younger.
Elaborate on that a little bit more. Like, how would Medicaid impact people, trans people?
Yeah, so in particular, there are changes that are potentially coming to the Medicaid program that could ban the provision of care for young people ages 19 of age and younger. And there are kind of two different iterations of what that may look like that could either harm greatly the provider providing that care, or a ban specifically on losing Medicaid coverage for the entire practice if you decided to continue offering that care to young people. And this would decimate the care of clinics if they decided to continue this care. And so clinics will be placed in a really hard moment. You know, can I afford to lose care for the entire patient population I serve to preserve care for this subset population that I serve every day? It's pitting one group of people against another.
And is that subset of population, are trans people impacted by HIV?
I mean, the surveillance data before the change in what we're able to collect definitely demonstrates that transgender folks are at higher risk for HIV. Again, when you look at the numbers, they're underwhelming in terms of the absolute number, but when you think about the size of the transgender community, it's a pretty remarkable percent who are living with HIV or at risk. So again, I'm sure San Francisco will figure out a way to continue to collect it, but many parts of the country, this is going to become invisible, which means that, you know, so much of the funding depends on what the epidemiology shows. And if so, the epidemiology is erased of transgender people, that means that it will be even harder to justify resources going in that direction.
But to your point, I think even in San Francisco, the system of clinical care here will collapse. I mean, if clinics are forced to choose between serving their patient population and keeping their Medicaid status or continuing to serve a population, these large hospital systems are going to have a really hard choice. And I don't see how many of them can choose one over the other.
Yeah.
And you've already seen it in some cases where they've started to shut down systematically surgeries for trans folks.
Northwestern today,
yeah.
Northwestern capitulated to the administration for gender-affirming care.
I mean, again, everyone who receives funding has been put on notice. Yeah. So CMS funding, HRSA, it doesn't matter. Like, they've all gotten the priorities, and they can be like capricious about it and decide that they can act on those at any point, which is, which will probably, I hope, mean additional litigation. But I think that, as Dr. Gandhi says, Monica said, I think also a lot of folks are trying to fly under the radar to try to avoid, bringing more attention to their institution.
I'm hoping that people will do something in all the spaces that you're in. But if nothing happens, what would be the first signs of the impact of all of these on the people? What would be the first thing people seeking HIV prevention services see, or people seeking HIV care see?
I mean, UNAIDS modeled out that if prevention, the thing about PEPFAR, and Dimitri said this, that they're kind of holding countries hostage. So countries will actually, they have taken on a lot of their treatment, but prevention's like a luxury, PrEP. And so UNAIDS modeled that we would be back to 2000 levels, the year 2000 by 2029, if we can't get prevention out. So I do think it's this increase in HIV incidence that's going to be first, because people will treat someone if they're ill. You have to treat someone in an ER. That was what people were arguing about with the shutdown. Like, you have to treat someone if they come in pregnancy. That's actually more expensive to treat someone in labor and not give them preventative care. So, but for prevention, it's it's considered a luxury. So I think we're going to see HIV incidence go up.
Yeah, I have like the most CDC answer to that in the world as a former CDC person, which is like, I would think about which indicators would be probably most interesting early, and I can think of a bunch of them. So pretty much anything on the continuum of care, I think, could be affected. And so I think one of the things that I would be interested in is also thinking about what happens to the average CD4 count of new diagnoses, right? So like, how much of this chilling effect is measured by people coming to late diagnosis? It's something that we use very often in epidemiology and in HIV to sort of gauge sort of how well the system is doing routine testing and if people are delaying their onset of treatment or diagnosis. So I think that there's a lot of sort of factors that you can look at. So I think linkage to care and retention, I think, are things that are measured and will be continually measured in things like Ryan White. And I predict that you're going to see a pretty significant shift in that. And I will just sort of, use my crystal ball and say, I think that will also map toward, they don't gather information about immigration status, but they do gather information about U.S. born or not U.S. born that sometimes used as a surrogate. So I would predict that it's going to sort of follow the sort of lines of exactly what you expect. Who you think will have a chilling effect is who will have a chilling effect. Trans people will likely have later diagnoses. Trans people will likely not be retained in care as much, especially if they're not able to get gender affirming care as part of their HIV package, whether that's for treatment or prevention. And I think that, you're going to see more AIDS diagnoses at the time of diagnosis because people are coming to care sick as opposed to for routine screening. So I think that there's a lot of sort of markers in the data that could potentially indicate that we're losing ground.
I'm going to come back to you, Gary. So you're somebody that's been living with HIV for some time. And how do you feel hearing about all of this?
To be honest with you, I feel like it's been 30 years of stress. I use the law of attraction, metaphysics, tarot, astrology, research. I use every damn thing. When I first got diagnosed, I told myself, if I'm the first person to survive this disease, no matter how it forces me into the limelight or some bizarre treatment plan. I mean, I had friends that were going to Mexico, having their blood drawn out and heated. People were trying anything to stay alive at the beginning of the epidemic when there was no medication. But I'm just fortunate that my will and a mentor, George Melton, wrote the book Beyond AIDS and was an early pioneer for self-healing and putting HIV in remission with his partner, Will Garcia. Will eventually passed. My friend George is still alive and well and speaking and educating. But he had said to me early on, you don't want to survive any disease or illness out of fear. Turn it around and find out what you're passionate about. And it's not a Pollyanna look at life, but no matter what illness you have to stay engaged in life and find your passion and keep working. So I channeled my passion with my development background and fine arts sales skills into fundraising. So I've been fundraising for 30 years, nonstop, with the help of tens of thousands of people, raised well over $1 million. And I'm not bragging, I'm just saying that you have to channel that fear and the shock and awe that's happening into action. So I'd be remiss if I didn't say, be registered and vote, and push it in front of everybody you talk to. It's one of the few places left where we can still make a difference and get in that voting booth or register if you're able to have your ballot sent to you. We have to vote and educate people. And, I have a lot of trans friends, and I just think don't ever underestimate the value of human contact with somebody. And you don't have to bring up the federal administration, just check on people and say, I'm just calling, I'm thinking about you, how are you doing today? And you don't have to save the world. I mean, I have a small 21-year-old Mardi Gras charity club, and we raise money for emergencies where you don't have time for a grant. If there's a fire or a flood, when Katrina hit, we raised $18,000 within 5 days of the levees breaking. And our friends in New Orleans said the only place helping is the American Red Cross. Well, they weren't very gay friendly, but we channeled the money through the local LGBTQ humanitarian agency, Rainbow World Fund, and that money went to the American Red Cross. So I just think in every situation you hear, there's something no matter who's watching or who's here, there's something you can do. Don't ever feel disempowered. It was the people who spoke up early with ACT UP and who laid down on the ground and did chalk lines. We had to force our government to pay attention. But this anomaly of this administration, it's temporary. The ringleader, the cultist leader is going to either die, or one of these people are going to get lucky with their aim, or we're all going to go to the voting booth and vote out all the Republicans because they're all complicit. So I just think I feel empowered. I just think I can do more. Donna Sachet and I did a pride brunch for 25 years that raised $645,000. My private disability is ending this month. After 30 years, this is the last month my private disability will pay me close to $2,000. So my only income on the books will be SSDI, which will be, it's about $2,400 now. It'll be $2,500 in the new year. My rent's $2,000 some dollars. So I'm really I'm going back to work doing gardening, flower arranging, event planning at 65 when I have new health issues, lots of things. But I just think you could hire somebody who's transgender or LGBTQ or who's on disability. Why pay somebody who's got a thriving business when you can pay a friend to dog sit, house sit, plant care, gardening? Like there's a lot of small things people can do, but most importantly, register and vote and pay attention. And in the meantime, we have these wonderful people that are full of knowledge and looking at it from all angles. But I just think that it just opens up so many opportunities to do something. You can put a jar out at where you work or pass a basket at your church and just say, this is going to a private transgender clinic in this city. Replace the funds.
Yeah. Is the state doing anything? So I have a question here, maybe Tyler or Monica can lean in. Is the state of California doing anything to help currently?
Well, Newsom's tweeting a lot. He's
All caps.
all caps, and it's humor can be very rewarding, but actually quite a bit of declaration of World AIDS Day today from California, which was really heartening because of the federal government's canceling of that. So that felt great, and I do think it's good that Medicaid, at least old enrollees that were already there, can stay on the state Medicaid who are undocumented, but I wish that the new enrollees could also come on. But it does feel different to be in California than it does in Atlanta or Utah. And so I think that, actually the nicest thing I've ever heard is what you just said, like these little tiny things you can do. I think that they are going to accumulate and we'll get to the end of these 3 years, right? Because it will end, right? Yeah, okay.
Yeah, I think we are incredibly fortunate to be in California, and for those who are here in San Francisco, we're even more fortunate, I think, to be in San Francisco in that we have long had a commitment from city government to backfill any cuts to any federal dollars that are eliminated here in the city. So we do have an obligation to hold our city accountable for that, even in the current environment. We have a new mayor in town who, in his campaign, promised he was the only person who in his campaign promised that he would backfill federal dollars that were cut in any budget process. And so I think as we head through this next public health budget crisis here in San Francisco, we have an obligation as a community to hold him accountable for his commitment to our community in that way. But if that does not work, there have been successful efforts led by the State Ending the Epidemics Coalition and my team at San Francisco AIDS Foundation to advocate for a large pot of money in the state budget to backfill federal cuts, which many states are not nearly as fortunate. There's like several millions of dollars sitting aside between now and June, just kind of waiting for community-based organizations to apply if they receive a federal cut in their grant budgets. There's a process to apply to backfill those dollars. Those dollars, of course, disappear at the end of June if they haven't been spent, but there is a backup plan.
So as we approach the end of our segment, I'm hearing that there are a lot of challenges. It's hard. A lot of our spaces are going through a lot. But I want to close with what drives you each every day? What gives you hope in this fight? And what is one call to action that you have for the audience? Who wants to jump in first?
Sure. I mean, I think that for me, the thing that gives me the most inspiration and hope is that sort of in the pathologically poor governing of this administration, there are opportunities that we need to move forward on. So I think sort of thinking of what's happening to public health on the federal level, there's not much left to salvage. I think we have to sort of start by that and say that the energy that we have should be focused on creating the new thing as opposed on trying to put Humpty Dumpty back together again. So my analogy is, we had the classical era of public health where we built the Acropolis. That Acropolis has crumbled. We're in a dark age. You don't try to rebuild the Acropolis, you make the Sistine Chapel. And so we need to work on the Sistine Chapel right now, not worry about the Acropolis. What if the political will is for things to be destroyed, they're going to be destroyed. There's nothing that we can really do to stop it. But what we can do is change the future. And so I'm really inspired that, we have the energy in the room and the energy in our community to sort of take this on. And I think we need to focus it on the thing that is the new thing as opposed to trying to salvage the things that are going to, burn away.
And what is one call to action you would have for people?
I think my call to action, I'm going to mimic you and say vote, but I'm also going to add one more thing, which is call your Congress people and talk about the things that we're talking about here. Because, I've had the great ability and privilege to go behind closed doors and talk to many people from both sides, Republican and Democrat, and they know that there's something wrong. And they're just waiting for the moment where they can do oversight and intervene. And so they need stories. And so my call to action is don't just wait to vote. Call your stories into the people that you voted for on Capitol Hill so that they have those stories and demand that they provide oversight for what is a corrupt strategy.
Thank you.
Well, I would say what I get the most hope from is that HIV has always been about activists, people living with HIV, NGOs, advocacy groups, clinicians, researchers. Everyone's come together. Everyone's on the same page. We always march together. Everyone's in sync, and we're in sync now, and it just feels really like an incredibly close community. Again, you come together and huddle together during hard times. So that's a lot of hope. And then the call to action is this reason I think this feels worse than being ignored altogether in the beginning of the 80s is we have all the tools. We have amazing treatment. We have long-acting injectables. We have these long-acting pre-exposure prophylaxis. That is so hopeful. Call to action is to get access to those long-actings in low and middle income countries, because we're in this era where we have them here, all the shiny stuff, and they don't have them in low income countries as my call to action.
Thank you. Tyler?
Yeah, I think what gives me hope is building off of what Dr. Gandhi has said, is that our communities have never waited for permission to save each other. You know, from the earliest days of the epidemic, it has been queer and trans brilliance and Black and brown resilience that have brought our community together, and it's been our innovation that have really outpaced the political attacks on our community. And I think it's that sense of community that has saved us multiple times, whether it was the beginning of the HIV epidemic, whether it was in the Mpox response when we came together to fight for what we needed here in San Francisco, or in this particular moment. I think we know what community means, and we know how to stand up with one another and for one another. And actions people, my call to action, I think, would be fight disinformation, fund the frontline organizations. We need you now more than ever. And always remember, stand up, fight back.
Thank you. Gary.
I have so many thoughts. I'm not really sure. I feel like what gives me hope are all these rallies happening across our country, from small towns like Guerneville in wine country, where there might only be 25 people on Main Street with their signs, or people in Utah, people in red states. It gives me so much hope when I see people be brave to be authentic. I would really say that is my major thing, is look at yourself and your identity and seek out people unlike yourself, especially if they're vulnerable, and support them. If you know that there's a Muslim person in your neighborhood, or a transgender person, or a gay bar, I look at the resilience of the queer community and allies repainting rainbow sidewalks, where the damn government's coming in being concerned about a damn crosswalk for your identity. You know, if it's the Italian flag in your Italian community, the St. Patrick's Day parade, I mean, just try to understand everybody else. And now more than ever, be authentic and be proud. When there's a big march and I see a pride flag in the audience, or a transgender flag, I just think there's bravery, there's courage. Not everybody has the luxury to do that, but if you do and you're not doing it, then you're not really helping. So I just say, be your authentic self and help the people around you that are different, that really need your support right now, no matter what that is. It could be money, it could be a phone call, an email. Be out in public and demonstrate. Just be out and be authentic, everybody.
Thank you. Thank you, Gary, and thank you to all of you. We're at the end of the segment, unfortunately. I know there were some questions that we're not going to be able to address, including the question about my heels. But we will be around, so you can approach us and ask us questions in the reception afterwards. I want to thank the panelists again for joining us tonight, and I want to thank Michelle Miao and the Commonwealth Club for having us. Thank you.
Thank you so much again to Dr. Naz Mohammed, and also our speakers, our esteemed speakers. Actually, for those who are here from Fly Bunker, will you just stand up? These are our amazing friends who have gifted our speakers tonight these incredible, beautiful floral arrangements. And so we're going to take some pictures, but I do want to make a quick announcement. Thank you so much to those who made tonight happen. Vive Healthcare, Kaiser Permanente, our friends at the San Francisco AIDS Foundation, and OSRA Medical. We have a reception tonight, so you can continue to ask your questions. We apologize if we didn't get to them, but we have some cake, some wine, some beverages, all that you need. If you have dietary restrictions or you have specific requests, please come see me. There's a Zen garden upstairs, the rooftop. We had hoped that we would hold our reception there, but it's a little chilly, so we want to make you comfortable. Thank you again, and so I hope that what you take from tonight is that we're all in this together. I'm Michelle Miao. You can reach us here at the Commonwealth Club at commonwealthclub.org. We'll see you next time.